Hi, I'm Andy Wilson. I'd like to talk about combating the spread of coronavirus by modeling fomites with depth cameras. Early on in the epidemic, there was a focus on how the disease is spread by touching your face. Government officials told us, don't touch your face. Of course, this is easier said than done. Here are some stills taken from a video of various officials touching their face in the same press events where they advise us to don't touch your face. It's pretty funny. Of course, technological solutions have been proposed. A number of projects use smart watches and sensors such as accelerometers and proximity sensors to detect face touching. Perhaps most relevant to the present work is the computer vision-based approach on the bottom right. It uses a webcam and machine learning approaches to detect when you touch your face. In March, I developed my own very simple prototype to detect face touching using the Azure Connect depth camera and the Azure Connect body tracking SDK. This was very easy to put together using a simple threshold on the distance between the head and hands. But there's more to virus spreading than face touching. Fomites are physical objects in the environment that when contaminated can transfer the disease to someone who touches them. This is illustrated to great effect by a video made by Mark Rober, a YouTube personality. He found a powder that shows nicely in a black light and gave a bit of it to some school children at the beginning of their day. At the end of the day, Rober showed that the powder had spread throughout the room. Today, we are still learning how COVID-19 spreads, but the discussion has moved on from face touching to wearing masks and social distancing. It seems likely that the virus can be spread through the air. However, CDC guidance still notes that COVID-19 may spread by touching contaminated surfaces. In fact, very recently I saw an article describing how New Zealand officials traced a single infection to a wastebasket in an airport, and another was traced to an elevator button. This paper contributes a suite of techniques that leverage depth cameras to combat the spread of the COVID-19 virus. We extend the earlier Azure Connect-based demo to include detection of face touching and handshaking among multiple people. And we add the modeling of potential fomites in the physical environment. To begin, we show using the Azure Connect body tracking SDK to detect face touching, not just as people sit in front of their computer, but as they walk around the room. We can extend this to detect people shaking hands. We can use multiple cameras to cover a larger area of the room and overcome some sightline limitations. Here we illustrate merging body tracking results. Red and blue body tracking results are from each of the cameras. Purple shows the merged results. We can detect when a tracked person touches the physical environment and create a history of where people touched. Here we test the hands and feet against the 3D model of the room surfaces. This is implemented on the GPU in a so-called scatter operation. We model the touch history as an image C. We compare the 3D position of each joint J against all 3D points in the physical environment, and then model the spread and uncertainty as a Gaussian distribution. The contamination map here increases monotonically. We explore a simplistic model of the virus spreading. We first show how joints can spread the virus by touching. Contaminated joints are marked in red. Note how the face joints are marked as contaminated when touched by the right hand, and then the left hand is contaminated when it touches the face. When the foot is contaminated, it then contaminates parts of the physical environment. Here the user begins with their left hand contaminated and then touches the back of the chair. The right hand then touches the back of the chair and is then marked as contaminated. Picking up the virus from the physical environment is calculated in a gather operation that can be thought of as the reverse of the scatter operation. Summations are difficult to do on the GPU. We use mip-mapping to compute the sum over the entire image. Finally, we can use projection mapping to illustrate the contamination map directly in the environment. This could provide some insight into how fomites evolve over time. We can also use projection mapping to illustrate when social distancing is violated. Here the green shading is used when social distance between these two is violated. Here you can see the social distancing calculations in the 3D graphics view. Of course, our prototype system has a number of important limitations. First, as with any computer vision-based approach, camera sightlines can be a problem. We can't work with what we can't see. Second, touch precision is fairly low since we are not observing touch directly, but rather proximity. This has been discussed elsewhere in the literature. Next, our prototype does not handle moving objects. Some work would need to be done to have the contamination map update appropriately as objects move. Finally, the virus spreading model illustrated here is extremely naive and requires much more work and validation. There are a few considerations on how to apply the techniques in the paper. First, is the real-time audio feedback appropriate? This depends on application, of course. For example, how many people there are in the room. Second, we might want to prevent touching rather than detect it. This might be possible through clever processing of joint position information. Next, I believe the system might be quite useful to monitor a space throughout the day. Give a HoloLens to the custodial staff so they can see the contamination map directly and perform targeted cleaning. Finally, we note that the system can be thought of as a kind of fine-grained contact tracing. Whereas we typically think of contact tracing as among individuals, the system could be used to trace who touched what in the physical environment. In conclusion, I presented a suite of techniques that leverage depth cameras to combat the spread of the COVID-19 virus. An open question is how we can properly and safely validate this work. Thank you.